Time now for the Business Spotlight on the WMAY newsfeed, sponsored today by the SIU Center for Family Medicine. Anne Daly is here with us. She is a registered dietitian. She is also a diabetes care and education specialist. And we're talking about the subject of diabetes. And Anne, thank you so much for joining us here. It's great to have you.
My pleasure.
Let's start by just talking about the prevalence of diabetes in society. How common is this?
Well, it's very, very common. We've been saying we have an epidemic for quite some time. And in years past, it used to be mostly ages 40 and up, but actually the prevalence has dropped down to ages 30 to 40 being the most the most number of new cases being diagnosed. And when you reach age 65, at least 3 out of 5 people either have diabetes or prediabetes, which is what precedes type 2 diabetes.
Just so we're all on the same page, explain how diabetes manifests itself when someone has it. What does it do to them physically?
Well, let me start by saying there are 2 types of diabetes, type 1 and type 2, and they're similar but different. The majority of people in the world have type 2, like 90 to 95% of all diabetes is the type 2 kind. And what happens there is that the body develops what we call insulin resistance at the cell doors, which means the release of insulin when they eat their meals is sluggish and slow. And so their blood sugars go up immediately after meals because the insulin isn't acting normally. And this insulin resistance is worsened by people who are overweight. It's also a problem for people who are sedentary. The more inactive, the more the insulin resistance takes over. And also aging is against us. So every 10 years of age, there's more people with diabetes.
You're checking off a lot of the boxes for me here, and I have a little bit of a family history with this as well. How much does genetics play a role in this?
In type 2, genetics is definitely a factor. However, we say that environment pulls the trigger. So while you may have a strong family history, you're not automatically destined to get diabetes. However, if you are overweight and sedentary and the other risk factors come into play, then you're well on the road, shall we say, to getting it.
I've seen firsthand the difference that diet can make in helping someone who has diabetes and helping them to overcome it, bring those numbers back down.
Right.
Talk, if you would, about that and what sort of dietary choices are best for someone to either avoid it or to recover from it.
Well, first and foremost, we want to control body weight. And the majority of people, the day they're told they have diabetes, are obese, according to medical criteria. So we work on helping bring the calories down to help them lose some weight. And the first and most important thing, if you want to bring calories down, is adding in vegetables and fruits, as many as you can get. But if they're fruits, they're higher in carbs. So we have to teach people about portions, what's a recommended serving and such. But certainly living on fast foods and fried foods and a lot of greasy kind of meats is not good for diabetes.
Can diabetes be fixed with just diet and lifestyle changes? Obviously, we know there are medications for it. How often is that required to really deal with the problem?
Well, early on, when the diabetes is not long-standing, there are some people who can make major, significant lifestyle changes and bring their blood sugars back down to normal, at least for a while. But the truth is that over time, we say that type 2 is a progressive disease, which means the longer you've had it, as in duration of years, the more medications we expect to be needed. So people may avoid being on medications for the first few years, but if in order to completely stay off medications, they would have to probably be like a jogger 5 miles a day year round, in order to stave off medications. And most people are unable to live with that lifestyle and would be ready to take some medication to help them along and live with a lifestyle that's doable for them.
So how do you and the other professionals at the SIU Center for Family Medicine help people who are coping with this condition and help them be able to maintain their health, possibly fully recover, or at the very least stop it from getting worse?
Well, the really most important thing when you find out you have diabetes is to get educated and learn all you can about it, because the person with diabetes is in the driver's seat for how this is going to go. Their physician or provider can give them advice and can order the medications, but it's the person who has the diabetes who has to make the choices and decisions 24/7 about what are they going to eat, what's on the plate and the fork, and are they going to go take a walk or not, and did they get their medication? Are they making sure they get it every day, that they don't miss it, things like that. So when we offer diabetes classes here at our center, and our classes are actually free, no charge, but they are for the patients that are with a provider here. They have to be under the care of one of our providers. And so over a series of 4 weeks, we run the classes that cover all the basic content areas people with diabetes need to know about. And during that time, we get to know that person quite well. We're looking at what their blood sugars are, and if they weren't checking before, we help them start checking so we can see how things are going. And very often we end up making changes on their medications because perhaps they're not on exactly the right combination to get their blood sugars where they need to be. So we give them special attention. But mostly what we do is help them get their head in the right place, because a lot of people are confused and have heard misinformation that's not true. And so we try to answer their questions and make sure that they're working with a full set of information, not just like 1 or 2 little fragments of information that they've heard.
So how do people reach out to schedule an appointment with you and get the help they need from the SIU Center for Family Medicine?
Well, we have a wonderful call center of people that answer the phones for us. And the main number here is 545-8000.
545-8000. Call and ask for family medicine. You can also learn more at siumed.org. Anne Daly, registered dietitian, diabetes care and education specialist. Thanks so much for your time here, and thanks for joining us in the Business Spotlight on the newsfeed, WMAY on 92.7, 94.7, and 970 AM.